Hello, my name is Dave Rakel. I'm the director of the Integrative Medicine Program here at the University of Wisconsin Department of Family Medicine. This video is on reconditioning the low back after pain or injury. I'm accompanied again by Amy Bauman, our third-year resident who's a co-author of this module. So Amy, the NICE guidelines talk about the importance of physical therapy, which is something that we're real comfortable utilizing.
Right.
It also talks about doing some back exercises and also getting the body back into a state of fitness.
Right.
And then we're also going to talk a little bit about yoga. But physical therapy we're pretty comfortable with. And I think physical therapists do it pretty well.
They do.
Their job is to get the patient reconditioned to the point where they aren't needed as much.
Right.
So that's kind of all of our job descriptions. It should be is how can we enhance resiliency in the patient with low back pain so they don't need as many therapies.
Right.
Tell me about some of the resources in regards to exercise for low back pain that might be available to the patient.
Right. So, as you mentioned, definitely physical therapy, something we're very used to doing. Sometimes the trick there is getting patients convinced that it's going to help.
Yeah.
I've run into a lot of cases where people have done it in the past or for whatever reason didn't feel like it worked, but talking to them about the importance of stretching the muscles that are tight and strengthening the muscles that are weak. And so that's...
The body starts to hold the dysfunction.
Right.
Which affects the mobility of the body.
Right.
Yeah.
And I think a conception people often have is that if they're working and they're doing manual labor all the time, that they're using their muscles and they're stretching, and so that they don't need to do physical therapy. But the idea that we're sort of retraining those muscles. And then beyond physical therapy, other things we can do, exercise obviously is a great thing. I think it's important to try to help people find affordable exercise or fitness programs that they can go to. That's always a challenge.
Particularly in this day and age where many people can't afford many of the therapies.
Right.
We need to really try and remove those barriers to get them to. What are some of the low-cost ones that you found helpful?
Well, something that people can do in any community is mall walking. You know, that's something that we can always talk about. If it's cold out and you just want to get people out walking, that's something that can be done. YMCA is often a slightly more financially feasible option. And then many of the gyms in different communities will offer programs that are discounted through insurance. So that's another way to make it more affordable.
Yeah. One of the techniques I like to use to describe the importance of reconditioning the body after low back pain is something I learned from a Feldenkrais practitioner, and they had us fold our hands together, and if we go ahead and do it. So you have your left thumb on top, right? So that feels comfortable to you. So that's like, this is my normal.
Right.
Even if I have low back pain, this becomes my normal.
Right.
I'm walking like this, but it becomes my normal. Now, if we put the other thumb on top, how does that feel?
Very awkward.
Very awkward.
Very awkward.
But what they taught me was if we sit like this every morning for 20 minutes for a month, this will start to feel pretty darn normal. And often it's this that we need to do to retrain the body back into a state of balance.
Right.
And get us out of that normal position of dysfunction.
Right.
And so yoga actually has some really good research to support its benefit for low back pain, which is described in our module. But you practice yoga.
Right.
And you have low back pain
sometimes. And I have low back pain, yes, and it helps.
So tell me about it. Why?
I think the great thing about yoga is it sort of encompasses all the things we've talked about today. It definitely, has the mind-body or meditative component, the awareness.
That's where the yoke, right?
Right.
The union of the mind and the body.
Right. And then it also has the physical conditioning piece that we've talked about, and the structural mechanical aspect. So I think if someone were to choose one thing, that encompasses all of the things we've talked about.
Yeah. A general hatha yoga class might be okay, but if someone's been dealing with chronic low back pain for a while, it's probably nice if it's available to have a therapist or yoga teacher who specifically can tailor it to the person with low back pain.
Right.
Yeah.
I agree. I think if you can find somebody who is really aware of the mechanics and what they're doing with people who have low back pain, you're going to have a better effect.
Yeah. Also, I mean, it's just also important to realize how the body wants to self-heal.
Right.
And I've just seen a number of patients have just some remarkable stories where some even had double laminectomies and are now running the Ironman here in Madison. And it often wasn't just one thing that got them there.
Right.
It's these three areas that need to be used together that can be guided by the primary care clinician through the patient-centered medical home, because this is where it needs to start.
Right.
We don't want to refer the patient too quickly to someone who doesn't know them at all, or they're just going to be seen as a physical part.
Exactly.
And not recognize the complexity of the biopsychosocial spiritual community aspect of who's carrying that pain and why.
Right. Yeah, and as family practitioners, we're in that unique position where we can help people. We have that role, and we can help people in all of these ways.
Yeah, and it's fun.
And it's fun.
When you start to see them as Bob with low back pain. Hey, I know Bob.
Right.
Versus, oh, that low back pain, I can't get it to go away.
Right.
We're always going to fail when we try and fix the unfixable. Fix it when you can, but when it's unfixable, let's walk with them towards a better place.
Exactly.
Hey, Amy, thanks for all your help with
Thank
this.
you.